Shanda Gallego.
I'm Felicia Rankin-Collins.
Visit us on www.radiocayman.gov.ky. Follow us on Facebook, Twitter, and Instagram.
Radio Cayman.
Your voice, your choice, your radio.
Radio Cayman's Information Hour, produced by April Cummings, Carsley Fuller, Dion Anglin, Shanda Gallego, and Felicia Rankin-Solens. If you see news happening, contact our newsroom, 949-7799. Radio Cayman News, the ultimate in news and information.
Radio Cayman, the voice, the heart, the soul of the Cayman Islands.
For the health of it, Radio Cayman's premier health show is brought to you by Healthcare Pharmacy, caring about your health for the past 25 years. The Cayman Islands Civil Service Association.
For the health of it with Tara Bush.
Brought to you by Holy Cross Health. Learn more about our comprehensive services by calling 1-954-351-5906. At Holy Cross Health, our mission is you.
Hello and welcome to For the Health of It. With me this evening is Dr. Lair. She is a doctor who specializes in geriatrics, and we're going to be talking about Alzheimer's and dementia. Hello and welcome to For the Health of It, Dr.
Hi,
Lair.
Tara. Hi, Tara. I'm happy to be here.
Oh, wonderful. Now we're going to we're going to be taking a break and then coming back for the full interview, okay?
Sounds good.
All right, thank you.
The Cayman Islands Civil Service Association, CICSA, is an association that brings all government employees together at the workplace, social events, and in matters of concern common to all civil servants. For more information on how you can become a member or to read our story, visit us on www.cicsa.ky or on facebook.com/cicsa.ky. CICSA, connecting, informing, and engaging our membership.
We believe that every life matters, and we're all connected. One community, one people.
No matter where you live, Holy Cross Health of South Florida is breaking down the borders that should not exist in advanced healthcare.
At Holy Cross Health, we have opened our doors to the world, bringing you exceptional healthcare.
The multicultural staff features doctors and nurses providing top-quality, compassionate healthcare while making patients feel at home.
Our Holy Cross Global Health International Services team provides support to patients and their families during their treatment, guidance on their travels and accommodations, and continued assistance throughout their recovery.
Quality medical care and advanced technology with sincere compassion and understanding. Be remarkable.
Learn more about Holy Cross Health. Email globalservices@holy-cross.com or call 954-351-5906.
Refilling and transferring your prescriptions have never been this easy. Simply go to healthcarepharmacy.ky and follow the easy directions from your desktop, mobile device, or tablet. All you need to do is pop into Healthcare Pharmacy in Grand Harbor to collect your prescription. They're open 8 a.m. to 10 p.m. Monday through Saturday and 10 till 6 on Sundays and public holidays. No waiting in line, no wasting your lunch hour, no stress. Just easy online prescription refills and transfers from the pharmacy that has been caring about your health for 25 years. Call 947-8900 to speak to a pharmacist or go to healthcarepharmacy.ky and make life easy.
This is For the Health of It with Tara Bush. Back to For the Health of It. Sorry, that was really loud. I have Dr. Lair. Okay, so I'll be talking to Dr. Lair. She is a doctor from overseas about Alzheimer's and dementia. And the reason for this is it's Alzheimer's Day and month is coming up, and we're working with ADASI to create some awareness about the disease, and Dr. Lair is going to be talking about how we diagnose it and recognize the signs of dementia. Hello, Dr. Lair. How are you?
Hi, Tara. I'm doing well. Thank you.
Good. Let's take a deep breath.
Yes, I was earlier talking to people about relaxation breaths. We need one right now.
So thank you for agreeing to do this show, and working. Sometimes it can be kind of stressful because of the technical issues that we have. You're overseas and we're here, and we're trying to make a good show for our people, our audience here. So thank you.
Oh, you're absolutely welcome. I was fortunate to come to your beautiful island several years ago and did some similar discussions, and I'm just very happy to be here tonight and build on that work that we did a few years ago.
Wonderful. So I guess what the best way we can start is explaining maybe what dementia is and how is Alzheimer's now categorized. I believe it is as part of a dementia rather than its own separate.
Yeah, exactly. That's a good way to think about it. So dementia, what I want you to think about as you're hearing that term is to understand that it's really a collection of symptoms. It's not just one thing, but it's a collection of symptoms in which there is a change in how someone thinks or behaves or exhibits their mood and personality that is a change from how they were several years, often 10 years before. You can think of it in those terms. These are illnesses that come over a very long period of time. So it's not anything that happens quickly. It's a slowly progressive change, but ultimately it's a change in how you think, how you interact with people, and how you're able to behave doing kind of day-to-day things. And if the change is sufficient enough, it rises to the level of an illness, and that's what we call dementia. And you're correct, there are many different illnesses that can create the dementia syndrome. Alzheimer's is probably the most familiar of all of them.
Okay. So in that, from what you just said, would you explain, say, give us a case in point of, this person used to be a happy-go-lucky person, told the truth, didn't spend lots of money, and, 5 years later, they're couch potatoes, they're spendthrifts, or they're stealing, they have before they used to be calm, now they have a potty mouth. What would you explain kind of what you're saying about, changing as you go along?
Yeah, that's a good way to think about it. So as first things first, though, understanding what happens to us as individuals as we get older will help us here, I think. So if you think of our brains getting older along with the rest of our bodies, here's one piece of good news, really, and that is our brains and our brain's ability pretty much stays intact throughout our lives. Now, you're saying to me already, wait a minute, I know I've had some senior moments now and again. And that's true. Most of us do in our 40s, 50s, 60s. We start having a little bit of these senior moments where we might forget something, or it takes us a little longer to figure out where we parked the car after we were at the shopping mall. But that hallmark change is pretty common, that things might take a little bit longer. But eventually, and even an aging brain is going to figure things out, unless there's an illness like dementia that's taken away that ability and changed it sufficiently that people can kind of notice the difference in us between the way we were and the way we are now. So your examples are really good ones because they cover the thinking part of us. Like you mentioned spending money. Some of us are more particular with our money and